The importance of diet in understanding past lifestyles cannot be underestimated since its effects are so influential upon the human body. Hunter-gatherers were members of a nomadic people who lived chiefly by hunting, fishing, and harvesting wild food. Their diets were mainly composed of deer, sheep, antelope, rabbits, hares, reptiles, and insects. They also had sparse natural resources that included seeds, berries, nuts, roots, leaves, stalks, and bulbs. They did not have access to many high sugar content, any fruits or vegetables with high sugar content, which led them to have a better dental health than what Americans do today. Hunter-gatherers needed big, strong jaws to chew the uncooked vegetables and meat that often made up their menu. Their jaws were large enough to encompass their third molars. Their teeth weren't as crowded as ours, and they also had less malocclusion. Scientists have long theorized that when hunter-gatherers moved toward agriculture and subsequently changed their diet, that this affected the development of their skull and jaw. They had really good teeth, but as soon as you get to the farming populations, you see this massive change. There are suddenly huge amounts of gum disease and cavities. Early farmers had a softer diet, consuming cooked foods that didn't demand such a high level of mouth strength. Over time, jaws became smaller and teeth didn't follow suit, remaining the same size as our hunter-gathering ancestors. Those early farmers shifted to diets dominated by corn and other grains, which turned the human mouth into an endless banquet of carbohydrates. But who doesn't love corn? Chances are, if you eat any processed foods, you are consuming corn, like Fruit Loops, ketchup, Oreos, Gatorade, Milky Way, or Snickers, or even any kind of soda products. Most likely, they all have high fructose corn syrup. High fructose corn syrup is a cheaply made sweetener that tastes as sweet as sucrose, but is made at a much cheaper price. This is because corn is so easily grown, and it can be grown in mass quantities. But let's think about it. Each cup of high fructose corn syrup has 871 calories. That's 236 grams of carbohydrates. I wonder how many cups of high fructose corn syrup is in your 2 liter of soda. If you drink a 2 liter of soda over 2 days, think about all the sugar that you're taking into your body and how that can affect your teeth. Dental caries is one of the most common childhood diseases in the United States. It is 5 times more common than asthma and 7 times more common than hay fever, and its prevalence only increases with age. Not only that, being American, the average American consumes about 22 teaspoons of sugar per day. That is about 77 pounds of sugar per year. This contributes to like the fruit snacks and gummies and different juices and suckers that kids love, which leads to bad oral health. When we're younger, we're not brushing as often as we should. I mean, let's face it, we're not brushing as often as we should now when we're older. But when we don't take care of our primary teeth properly, that sets a bad stage for our permanent dentition, which leads to malocclusion and caries, in which we'll have to have restored. As I mentioned already, our diet today includes fast foods, frequent snacking, and regular intakes of foods that have high sugar content. All of these factors put our teeth at risk for dental caries. It is important to reduce the quantity and frequency of fermentable carbohydrates in our diets. The foods such as crackers, although they're not sweet, are cariogenic because they contain refined carbohydrates that stick to the teeth. They remain in the mouth long enough to be broken down into sugars that can be used by the bacteria in plaque. This is another big issue that we have. We are not brushing our teeth as frequently as we should be. We don't brush as long as we should be. We have to brush longer and more often in order to keep from preventing dental caries and dental disease. If we are going to improve our dental health, we have to take action and be proactive and take preventative measures such as all of the things like fluoride and in our waters and in our stuff. We need varnish. We can change our diets and to have healthy dieting habits and to choosing complex carbohydrates such as fruits and vegetables that are less cariogenic because they clear the mouth before they are converted into simple sugars, and that way they are not used by bacteria to cause plaque. If we need to brush at night, we need to use mouth rinses. We need to be more proactive.